to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're diving deep into the world of genetics, rare diseases, advocacy, and the power of storytelling in healthcare. Kira Dineen is a certified genetic counselor, podcast producer, and host of award-winning podcast DNA Today, which has educated and empowered thousands of listeners around the world. She's also a cytogenetic technologist and practices in a high-risk prenatal setting, helping families navigate some of the most emotional and medically complex decisions in healthcare. So I'm very excited to welcome you today. Thank you so much for joining us, Kira, and welcome to the show.
Thanks so much for having me on, Elena. I really appreciate just your show and being able to educate so many people in the community.
Of course. Well, let's get started with some basics. For listeners who might not be familiar with what does a genetic counselor do? How can genetics play a role in everyday healthcare? I said it's kind of basic, but I guess it's not. It's kind of a loaded question. But if you want to kind of give us a little bit of information on that, it'd be great.
Great question. A lot of people ask me that, like, what does a genetic counselor even do? I like thinking about genetic counselors as healthcare providers that help people understand their own genetics so they can make decisions about their healthcare or a loved one's healthcare. And that's the type of genetic counselors that work directly with patients. But even expanding that, genetic counselors can work in so many areas of healthcare. Elena, as you were indicating, sometimes genetic counselors help physicians, nurse practitioners, other healthcare providers understand genetics so they can better help their patients. Genetic counselors can also sometimes work in marketing and helping on that side of the public understanding as opposed to like a direct patient care or direct educating other healthcare providers for that downstream effect. So it's a tough question to answer because genetic counselors do so much, but our background is that all of us have a master's degree in human genetics, and that positions us to be well equipped to understand and keep up with genetics and break that down into layman's terms or different levels depending on who that healthcare provider is or audience so that they understand it. So I feel like we're the genetic knowledge keepers that then are like, okay, let's take this information in and push it out in ways that people will understand to help them.
That's amazing. That's very well explained. Thank you for sharing that. I think that really helps myself and our listeners, get a good understanding of that. So you've been hosting DNA Today since about 2012. Is that correct?
Yes, it's been quite a few years at this point, I guess.
That's pretty amazing. So that was long before medical podcasts were kind of a big trend like they are today. So what inspired you to start it, and how has it grown over the years?
Yeah, so it's interesting because back when I started podcasting, I even started a year before DNA Today with a different show. So I started in 2011. And back then, when I would explain it to people, they're like, what's a podcast? And so I used to have to say, like, it's like an internet radio show. So I like thinking of podcasting in terms of how people understand it in the public, or like not how they understand it, but just if they've heard of it, is pre-serial podcasts and post-serial podcasts, because basically the week that came out, I didn't have to explain what a podcast was anymore. But
Oh,
really
wow.
yeah, right. It was interesting. Yeah, huge. Sarah Koenig had, as the host of that show, had a huge impact in the podcasting landscape. And for me personally, getting into podcasting, I saw it as such a great place that it was more intimate than a blog. And obviously at the time, there's a lot less competition, and still is. If you're comparing it to starting a blog versus a podcast, obviously a lot more work and effort goes into creating a podcast. And I also saw it as such a great way to hop on a call with people or in person, connect with them, and have such a meaningful conversation in such a short amount of time and build my networking. And so, I started the show back in high school. And so it's just grown from there. Never did I ever think that I would become a podcaster almost more than a genetic counselor in terms of where my time is spent. and just in terms of building my business and everything. And yeah, it's just been such a great experience. But some of my favorite interviews are talking to patient advocates and hearing their story or their child's diagnostic odyssey and what they have to share with me and my listeners, especially for feedback they have for healthcare providers and what they've done and what they want us as healthcare providers to be aware of. So those are definitely, I think, some of the more interesting and storytelling episodes.
That's amazing. That's quite an accomplishment. That's amazing that, it started so long ago and it's grown so much over the years. That's wonderful. You also currently work in a high-risk prenatal practice, is that correct?
Yes. Yeah. So I used to be full time. And then with podcasting taking up more and more time, I've cut back to part time, but it's the same position. So I'm just a
Oh,
little more
nice.
efficient with how the patients are scheduled at this point.
So what advice would you give someone who's maybe just been referred to you or, a genetic counselor for prenatal?
I love that question because it's really helpful when patients know what they're headed into
Yeah.
and if there's certain information they can collect before meeting with a genetic counselor. So, as you said, in this pregnancy area, so meeting people either before they conceive and they're looking for some insight and anything that they should do before they try to conceive and become pregnant, or more commonly, meeting with people when they are pregnant, usually towards the end of the first trimester. And what I recommend is for, I guess, two things. One is talk to the person in your family, if there is one, sometimes a mom or a grandma that knows a lot of the family health history. So I am often in sessions with patients and they're like, oh, I don't know what kind of cancer that was in this individual in the family or what age. Let me text my mom real quick or let me text my uncle or something. So that can be helpful just to have a conversation ahead of time. And the other aspect I think about is if someone is thinking about trying to conceive, my soapbox is look into something called carrier screening because this can actually be done before pregnancy and it's even more useful before someone's pregnant to allow them more options in decision making in case there is a condition flagged on that screening that your biological child could be at risk for. So I love when patients come before they're pregnant and say, hey, I just want to know if there's anything I should do. And I'm like, wow, yes, let's talk about carrier screening and see if that's something you want to do. And that includes conditions like cystic fibrosis, sickle cell. Those are probably the conditions, if people are familiar with any of them, it'd be one of those. But a lot of these conditions that we call autosomal recessive, where both biological parents need to be what we call a carrier in order for a baby to inherit this. So it's really helpful that we can just look at the intended parent's genetics and say, is there anything on our radar that maybe instead of conceiving naturally, we should look at other options like IVF to prevent a disease from being passed on? So I love when people are aware of this before pregnancy and know that this is an option to do.
No, I love that. That's amazing. So I'm going to ask you something that I know a lot of patients like have asked, and working in healthcare, I know a lot of times like the logistics of how like everything works is sort of common knowledge to us. But like on the outside, I know patients will ask me questions, and I always think like, oh, I never thought about that, but that's kind of good. So one thing that I've had asked a couple of times regarding genetics counseling and stuff is if like you have a patient come to you, do they actually do or get an order or get the blood work or done like within your office, or do you send them to someone else? And like should they be prepared to either have like some type of order for genetic testing, or what can they expect like when they leave basically?
Super helpful, all the logistics, right? And how
Yeah.
to prepare. So, most genetic counselors will be able to put that order in for that genetic testing at the end of the session. And depending on what is needed to collect that sample, usually people can do it that day if it's a blood or saliva sample. When we're talking about kiddos, sometimes we more want to prepare to do a blood draw on, let's say, like a 5-year-old. But, if
Sure.
you're talking about adults, usually that can be done that day. So I can, speak to in my office because I practice in Connecticut.
Mhm.
Connecticut has licensure for genetic counselors. So
Nice.
I order my own testing. It's my name on the test as
Nice.
opposed to having the doctor at the practice have his name on it. Now, if I worked 10 minutes down the road and was over the line and working in New York State, they don't have licensure. So then the doctor I work for, it would have to be his name on there. That's a paperwork aspect. Everything would still go the same way in
Sure.
terms of offering the testing, answering questions, having that sample drawn at the end of the session. And, sometimes certain tests, as I mentioned, you could collect a spit sample. So I see most patients nowadays in a telehealth format, and I just send a saliva kit to their house and usually gets there in about 2 days. And then they spit into it and then mail it back. So sometimes it doesn't even involve you having to leave your house to have an appointment. That's more and more common, in the last 5 years with COVID impacting healthcare and just being able to increase access to genetic testing services.
No, that's wonderful. I think that's so helpful. I'm a big supporter of telemedicine in that because it does really help with like efficiency and expanding availability and things like that. So I love that. And so you mentioned you're in Connecticut. Is that the state that you solely are licensed in, or do you offer telemedicine in other states?
Great question. So, a lot of genetic counselors that work for big companies that see patients all over the US, sometimes in Canada, they will be licensed in dozens and dozens of states. So, there are some genetic counselors that if you ask them that, they'd be like, yes, and they would start rattling off states. Over half of the states, I can't remember the exact number, but over half of the states in the United States has licensure. I saw that Nevada recently was added to the list, and there's a lot of benefits to having licensure.
Mhm.
The one of the drawbacks is yes, you have to actually get licensure in that state.
Right.
So because New York doesn't have licensure, I can see new patients that are residents of New York
Nice.
and other states that do not have licensure. But if there is, let's say, a Nevada resident that wants to see me telehealth, I wouldn't be able to see them because I'm not licensed in Nevada, but there's plenty of other genetic counselors they could see.
Nice. That's wonderful. That's helpful to know, for people that are looking to kind of see like who they can see and can't. But of course, I'm sure they can reach out if they were unsure and get some more information.
Yeah, a really helpful tool is findageneticcounselor.com. And this is provided by the National Society of Genetic Counselors. And so it's a really easy tool that you can basically select like what you need, whether it's a pediatric, cardio, neuro, cancer genetic counselor. And then if you want to see them in person or telehealth, and it will really help you identify a genetic counselor either in your area or that is the right either licensure or something to be able to see you. So that's like the best resource there is, at least for people in the United States and Canada.
No, that's awesome. That's wonderful. So, one thing we admire is your passion for rare diseases, specifically rare disease advocacy, which is also one of our main focuses of that pathway. We help a lot of patients that have rare or undiagnosed symptoms, and so why is that so important to you? And what role can podcasting or digital media play in that space for you?
Rare diseases has certainly pulled at my heartstrings for, over a decade now. I think just meeting with so many families that are personally affected by rare diseases has had a big impact on me. And it's led me to do as much advocacy work as I can for rare diseases using, podcasting, social media, email marketing, all of these different platforms. I think for people in general, at first they think, oh, well, rare diseases, if we study this, it's only going to benefit a few people. And that's just wrong. So, what's really interesting about rare diseases is we're seeing a presentation of a very specific, usually genetic change that's happened that's led to certain symptoms. And it is an opportunity to research human biology and how this works. And so there's been really important research coming out of that that then affects very common or basic conditions. So even, there's a rare disease that a few rare diseases that are like aging disorders where basically the biological age of someone is much older than they are. Like, let's say their birthday, they're 10 years old, but their genetics, it makes it look like they're 30 or 40. So there's some conditions like this where we can study aging, which is obviously something that affects all of us, right? If we think
Sure.
about cause of death, and especially the United States, probably if we collect a lot of different causes, they could all be categorized under aging. So this is something that's been a big focus. And even a recent episode of DNA Today, we talked about telomere biology disorders. And so I went in person to an event in New York City and got to talk with a researcher and a patient advocate about an upcoming clinical trial in the fall of 2025. And it's remarkable of how much we can learn just about general human biology from studying these rare diseases. So for those that are like, well, does that make sense fiscally? And you're looking at it from a very logical standpoint and trying to take out all emotion. Yes, this is still so important. And there's so much that we can learn from rare diseases.
No, I think you brought up amazing points. That's also true. There's so much unknown still about rare diseases, for sure. So, for someone listening today who wants to learn more about their genetics, where would you say they should start?
Oh, that's a tough question because it's so
I know
broad.
it kind of depends on what specifically.
Right, right.
So
Yeah.
maybe let's take like prenatal. Let's say they're someone that's looking to possibly get some conceive and they're concerned about some things. Do you recommend they just first like call to find a genetic counselor? Did they go to their PCP? Like what would you say the first step would be?
Yeah, so at least in a prenatal standpoint, which I appreciate you narrowing the question to make it easier for me, because I'm like, oh my gosh, I could give you a whole list of amazing resources. We'd be here all day. But in terms of after someone finds out they're pregnant, certainly recommend, and just in general, to find an OB or an MFM. MFM is like
Sure.
the highest level of OB, and usually within that, they'll start directing you in terms of different genetic testing. But I think it's helpful to be aware of two major genetic tests. One we already talked about, the carrier screening.
Mhm.
And then the second is a test that's been around for over 10 years now. The generic name for it is called non-invasive prenatal screening. Some people call it testing. And this is a simple blood draw that looks at a blood draw from the pregnant person, and it's able to analyze DNA from the pregnancy because the placenta naturally releases cells that release their DNA. And so within a blood draw, we can capture that and analyze it in the lab. And so this is looking for random genetic conditions like Down syndrome. And a lot of people will know of this as the blood test that can look at the predicted sex of baby. So if people are not sure if they've heard it before, then you start explaining that. They're like, oh, yes. So if anyone finds out in the first trimester
Before
about
their
the predicted
ultrasound.
sex of their baby, yeah, without ultrasound, that would be the test. So I think that's like two helpful things to know. But I find the National Society of Genetic Counselors has so many great resources. And, I guess I have to throw my own show in there. DNA Today is having a lot of resources. But beyond my own show, this year I launched a new science podcast network called Gene Pool Media. And there's so many other great shows within that, and
Oh,
all
amazing.
spans different science, a lot of genetics, which makes sense. Those are a lot of my connections, but also pharmacy and other types of aspects.
That's amazing. Those are great resources. I'll have to check out the other stuff because I didn't know about those yet. That's awesome. So I'm sure our listeners would love to know more about DNA Today and are curious how they can connect with you. Where can people find more information about you and your work that you're doing? Is it your website or maybe on social media?
Yeah, I would say all the above. Just head over to Google DNA Today, and our website will pop up. Our social media, I think looking at genepoolmedia.com is going to be the hub for all the science podcasts within our network. And yeah, you can kind of pop around, but it's probably easiest for wherever people are listening right now. If they want to check out the podcast, just search that because we're in all podcast players.
That's wonderful. That's amazing. Well, thank you so much for being a guest today. We've had a great conversation. You've shared so many great resources. Your passion for education, advocacy, and science in advancing quality patient care is amazing. Thank you so much for helping us better understand the role of genetics in healthcare and for everything you're doing to support both patients and providers. I really hope this conversation helped our listeners feel more confident as they navigate their healthcare journey. And thanks again.
Thank you so much, Elena. This was a lot of fun.
If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.